Vaccines are arguably the most important public health tools available today. Since the successful eradication of smallpox, with the use of vaccine, many vaccines have become available to man. Of great importance to public and child health are the vaccines against the so-called 6 killer diseases of childhood, talking about the measles, pertussis, diphtheria, tetanus, tuberculosis, and poliomyelitis. In the last 2 decades, effective vaccines against the major causes of pneumonia and other childhood killer have become available. Despite the availability and effectiveness of many vaccines, the benefits to a country is highly dependent on a viable and sustainable health system, which include adequate financing, dynamic and motivated workforce, strong partnerships, and effective community participation. Today on your regular Health Talk TV show, the physicians will be discussing vaccines and immunization, the past, the present, and the future in Nigeria. Stay tuned. Welcome to your regular Health TV talk show, The Physicians, where your health is our business. It's actually going to be a very great day because we want to tell you a whole lot about some topics that you've been expecting. My name is Dr. Martina Agberian, your regular anchor on this program. And with me is my very delectable, elegant, and beautiful doctor, always known as the celebrity shrink.
I am Dr. Immunization. Of course, welcome to your favorite health TV talk show, The Physicians, where your health is our business and will always be our business.
Yes, my celebrity shrink, Dr. Mimuna. You look really beautiful.
And you too.
Thank you. Thank you.
Without the natural
hair. I think I just
looking younger.
I think I want to go with this look.
I support that.
Yeah, actually. So talking about vaccines and immunization, the present, the past, and the future. Rather the past, the present, and the future. And remember, there was a time that one of our guests came and told us about being vaccinated and not being immunized.
that stuck with me for a very long time, and it actually confirms certain things that you will not even as we are both physicians, you know, hearing that you could be vaccinated but you are not immunized.
And you know what happened when I got home? And
I brought that.
Everyone was there.
Yes.
And I'm sure when they even made that statement, you can be vaccinated. People kept checking.
People check. So people even snap picture and said to me, look, I have it. That means I'm vaccinated and I'm immunized. And that is just it may sound as if it's fun, but that is the truth.
It's the truth. And one of the reasons she actually gave was that probably because of the poor cold chain,
storage issue, maybe the timing. So there are different reasons why, you know, you could be vaccinated but you are not immunized. And that also shows, you know, because when I was going to start my residency program we went through medical tests, and one of the things they told us to do was mantle tests.
Okay, yeah.
And you know, some people, it was as if there was a problem. So that just took me back that maybe then when they were vaccinated, they were not actually immunized.
Even for food handlers.
Even for food, especially those people with hospitality business.
Yes, I'm excited, and I'm sure our audience, everyone is actually excited, looking forward to hearing what we have to say today. We're back after the short break. Stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome to your regular Health TV talk show, The Physicians, where your health is our business. Today we'll be discussing vaccines and immunization, the past, the present, and the future in Nigeria. With me in the studio is our very cerebral Dr. ALERO Roberts. She is a consultant public health physician with the Lagos University Teaching Hospital. Dr. ALERO, you're welcome to our program.
Oh, thank you. Thank you.
Smiling ever. Thank you for always honoring our invitation this time
Exactly.
we call.
It's my pleasure.
We don't have a lot of you now in our
Sadly, not anymore.
that are
It's not
interested.
anymore.
Not
No.
anymore.
But thank you for staying behind to impact
Knowledge.
to us and of course to the general public. Thank
The grass is only green the side on which you water
you.
it.
I like
So
that.
thank you for watering the grass on my side of the fence.
So what I'm going to be talking about vaccines and immunization, the past, the present, and the future in Nigeria. Maybe a lot of us start. What is vaccine? What's the difference vaccine and immunization?
Okay, that's a good one. Vaccination is the act of giving an antigen to the human body to provoke it to produce antibodies to fight the antigen. The antigen is the disease-causing element, so it's either a virus or a bacterium, or, yeah. So and it's usually inactivated. So the antigen is what provokes, that causes the disease, and it provokes the body to produce an antibody to react. Immunization is what happens when the body has received it and starts to produce the antibodies to make sure you can't get it again.
Okay, so that is when you say the person is immune.
That's when you say the person is immune. You know, with that immune, we heard a lot of it during the COVID years. We all know about it. Is that the germ, the virus or the bacteria comes to you, and you can say, "Hey, not here. No parking. No space here. We are not at home for you. I no grief for you. No grief for this one." That's the immunization.
So before we talk about the main, you hit it on the nail, right? Let's talk briefly about the benefits of immunization before you now tell us what happened in the past, the present, and where we are going.
So, I mean, the benefits of immunization are basically that we are surrounded by these diseases. We're surrounded by, they are co-inhabitants with us on this planet Earth. And the diseases are many and myriad. I don't want to spend the rest of the program trying to list them out for you, but we are surrounded by them, and many of them are killers, and in the past used to kill. So the benefits of immunization is that we have now found a way, it's in fact the most effective public health tool of stopping people from dying from these now preventable diseases. So I mean, we saw what happened with polio, how we eradicated polio through immunization. We have seen the work we have done. Many of us are witnesses to the testimony of polio and how we got rid of polio. Did I say polio before? Smallpox was the first one. Was the one I wanted to mention.
I thought we were already doing that in Nigeria for polio.
Well, I was a recipient of the smallpox vaccination when I was a child in school, when we had the mass, and until smallpox was eventually eradicated in the entire world. And we have actually eradicated a disease, and now we are all witnesses to what we are seeing with polio through immunization. So the benefits are many and myriad, and the most important thing is that these otherwise killer diseases don't get a chance to kill you.
Yeah. So now we have, and it's good that we are breaking it down to what vaccination is, what immunization is, and of course the benefits that comes with when you get vaccinated, you are immunized.
Yes. And
I remember at a particular point in one of our previous episodes, it's something that we even talked about now, is that when you are you can be vaccinated and you are not immunized.
That's right.
And that's, for me, it was a good way for people to really find out that, look, there are some things that you actually think you have done right, but something went wrong the other way. But for this current episode we are having today, now we are now saying, look, okay, we have talked about this vaccination, but it's also good for us to go back the memory lane, what we have now, and futuristically, because we are just coming out of COVID, where we know what happened with the conspiracy theorists with regards to I'm not going to exactly. So let's bring it back home. The past, the present, and the future when it comes to vaccination.
So immunization in Nigeria started in the 50s when we started having these mass vaccination campaigns. Again, it was triggered by the global effort to eradicate smallpox. And we started having mass vaccination campaigns, and the benefits were evident immediately. But it was in 1976 when we had do you remember the expanded program of immunization? Where as a country, we took a commitment against the top 6 preventable diseases in infancy.
Which are, let's bring them here
now. Tuberculosis, yes. Now let me start. Yeah. Tuberculosis, polio. Before measles is at 9 months. Okay. So I'm thinking polio, pertussis, diphtheria, and tetanus. Then measles at 9 months. So I've gone according to the age at which the baby gets. That's the only way. I mean, it's true. Medical school. Do you remember?
Yes. At best.
At best.
Yes. The oral polio.
Then you have 6, 10, and 14 weeks. Yes. You had the trivalent at that time, which was DPT, diphtheria, pertussis, and tetanus.
But even at 6 weeks, they've introduced the hepatitis.
Now we have the pentavalent, which has now introduced the pneumococcal conjugate vaccine and hepatitis B. So yes, those are the top killer diseases in children. And it's so amazing because I remember when the late great Oliko Erason Kuti, our teacher of teachers and professor of professors, when he was minister, we achieved our highest coverage rates. Then of almost 91%.
It's talking about the past.
That is the past. That is the past.
Oh my God.
Where we had fantastic 91%. Coverage and we were getting babies who were being vaccinated and immunized.
Very important.
So that was where you were talking about it earlier. The cold chain system was set in place because it's not just enough the mother dresses up, carries her baby to the clinic and accepts a vaccination on behalf of her baby. That's the end user. Before then, a lot of hard work has gone on. Orders have been sent to the vaccine production companies in other parts of the world. Airplanes and ships have brought the vaccines in under deep refrigeration. They have been stored under deep refrigeration. The vaccine depot, we have one in Oshodi here in Lagos and 2 or 3 others elsewhere in the world. And they've been stored, then the vaccines have been taken again under very cold conditions and everything. And it was maintaining that cold chain that that brought us to prominence at that time, because we were doing this very religiously. Very well, religiously. And I must mention that even despite the COVID controversy, WHO had to commend Nigeria for maintaining that cold chain, and we had to remind them that this is a cold chain we have had in place and maintained
since the 70s.
Since the 70s. All through the polio era, we were being able to maintain the cold chain.
I'm proud to be Nigerian, really.
Right, so there are times when we are proud to be Nigerian. We've had 1 or 2 spectacular failures, but that will be talking about the present and the future.
So the present,
what do we have now? Very poor coverage. Our coverage has dropped to 30%.
From 91% to 30%.
Dr. ALERO, you said we already did like 91% coverage. And now we are at 30%. What happened? What is the problem? What happened? What is responsible?
To borrow a phrase from a great man hiding behind the cameras, it is a reflection of the country. Because you will ask, what is the cause? So let's break it down. This is Immunology 101.
Yes.
Medical school, second year. We measure the immunization coverage by the proportion of children who by the age of 2 have received their full complement of immunizations in a timely manner. You got BCG at birth, not at 3 months, 4 months, 5 months. You got your 6 weeks, 10 weeks, and 14 weeks at 6 weeks of age, 10 weeks of age, 14 weeks of age. And you got the 5 antigens: diphtheria, pertussis, tetanus, hepatitis B, and pneumococcal. Then at 9 months, you got measles, and guess what? Yellow fever. At 6 months, you actually got the vitamin A drops, which are repeated again at 12 months. So that by the age 2 years, we now ask the mother. And we had a fantastic, you remember the great Professor Ian Morley, who introduced the home-based health record card. And the mothers would come proudly with their
That's
card.
how
They still have them.
They have those
Yes,
things,
because it was evidence that she was a good mother.
Exactly.
And there's no mother that has a child that says, oh, I'm going to be a bad mother. So we measure, we count how many children in that birth cohort got immunized in a timely and effective manner. And if 100 children were born, 91 were, that was where our 91% coverage rate is. Let me read you some figures in a study, and I can send you the link to this study so that you know that I'm not just bringing numbers from the top of my head. 1/4 of all children aged 12 to 23 months had received 3 recommended doses of polio, but many missed the corresponding 3rd dose of diphtheria, pertussis, and tetanus.
Any reason why they missed it?
What did he say? That
Reflection
of the country.
So the country didn't provide this
Well,
vaccine.
you are talking provision, you are talking availability, you are talking access, you are talking even affordability. Then finally you are talking the 5th
What do you mean affordability is free?
Acceptability.
Yes, what is free? The vaccine is free.
But getting there.
The getting there, the cost of the needle and the
syringe,
syringe
The
and
human
Are the
resources.
parents,
human
the
resources.
parents pay for those ones?
somebody has to pay for it. Somebody has
There's
to
a
pay
whole
for
value
it.
chain to
We
this.
didn't used to pay for them. In the
Exactly.
past, we didn't used to pay.
There's a whole
No,
value
we
chain.
are not expecting, because ideally the baby should pay. Nobody expects the baby to pay.
Exactly.
The next best person is the parents.
The parents, yeah.
Nobody's expecting the parents to pay.
It's a
either.
government thing
So this
to
is a
make
value
sure.
chain.
So that's where you now come about the failure.
Yes.
It's a failure, yeah,
That's
it's a
the-
reflection.
Wow.
Yes. Then you have to think of the acceptability, because if you have generations of mothers who are not being taught
To do
the
this.
value and importance
Yeah.
of immunization and growth monitoring, you have also generations of mothers who are not being taught essentials of child survival.
Okay.
So what did he say? Reflection
Reflection
of the country.
So a lot of advocacy should have
So
been
a
done.
lot of advocacy
From
needs
pregnancy
from-
to
yes.
antenatal to
Yes,
delivery.
children should be coming home from school, say, mommy, mommy, mommy. They say you should sign this, that they are coming to
Come
give
to
us
just-
immunization. Mommy, will it hurt? And then the
No,
mother should
to
pet
not
her child.
educate
Say, okay,
them.
if you do, I'll give you puff puff. I'll give you. You understand? Because that's what
You're
we
right.
to us when
Yes,
we were in
you're
primary
right.
school. When they were coming on with the smallpox and then the yellow fever, I remember twice I had to take. They had mass immunization of yellow fever. You remember
Yes.
that gun?
That gun.
Oh, you remember?
I remember the gun.
That gun. And we used to stand in the line and all
I'm
of
not in
us.
your generation. I don't know what people are talking about.
You understand? All that has stopped. Now, that requires for you to have that affordability. You have to have the human resources. You have to have the materials.
But we are proud now children come on with their
marker.
mark that they have been immunized.
Yes, that was for oral polio.
Oral polio.
That was for oral
Yeah.
Can you
polio.
tell us about the statistics somewhere?
So, they said more children in Yobe, 3.8% of the children in Yobe,
Which is a state in the northern part
Yes.
of the country.
2.5% of the states of the children in Katsina,
Okay.
Zamfara,
Okay.
0.2%.
You don't mean it, please.
Is there a failure of the society now or the people?
The health providers,
Yes.
the community health, health providers.
It's still a reflection of the
It's an
society.
equal opportunity bad belle failure
Push.
of the Nigerian system towards these Nigerians.
Wow.
I'm sorry.
0
Let's
points.
say the truth as it is.
That is why we are here on the program, the
most
physicians.
voiceless, most vulnerable of Nigerians are being failed by Nigeria. Let's take a break and wrap our heads around
0.2%.
of children from Zamfara receive all recommended doses.
That's high low. And that's a huge population there.
Yes, I want to ask, how about in the south? Is there any record from the south or the
The
west?
best geopolitical zone with the highest coverage is, guess what? First prize, second
The
prize.
south?
Lagos.
Southeast.
Are you
Wow.
Yes.
That's interesting.
And
Really
when
interesting.
the sociologists found many reasons for it. The mothers are older, better educated,
Wow.
more committed.
older, better
The mothers
educated,
are they're
older than
older.
because
You
they
know,
know we have a
the
lot
younger
of
ones
teenage,
Yeah, okay.
underage mothers.
You see
who
the-
have
you
no
see
Maybe
the-
that is what is responsible for the low ones that we have.
Yes.
You see
Yes.
the complications.
Do you think culture has a way to
early
something
marriage?
here?
Exactly.
It is culture is part of it. Because if education is not entrenched in your culture, if formal education is not entrenched in your culture, you know how the Yorubas and the people in the southwest and the southeast, as a child is getting, before the child is 2, he's going to school.
Yeah.
That's true.
Yeah.
That's true.
The most important outfit a child is inculcated to want is his or her school uniform. And his or her school bag.
Bottle.
Yes.
And
water bottle.
That's very good. Thank you for not forgetting. It's a culture thing.
Yeah.
It's a culture thing. So you will see those mothers working hard to ensure that their children get educated because they themselves are also, even though if they are not, they have seen the value of education and they know that if their children. So education and culture are very closely linked.
They're woven.
Yes.
Wow. Not getting to the figures again. Maybe you want to talk about
the future.
The future.
Let's talk about the future.
About the future.
Yeah.
It's
Where
a
are
good
we
question.
going?
Yeah. Where are we heading?
Because with what you have now, 30%.
I don't think I'm the
think-
right person to ask where we are going because what I am seeing now, I have a situation now where people are, you remember I had my phone almost disrupted the program, and the problem is the cost of transport to the health facility is something that the woman has to consider. Does she feed the children or leave those ones to take the baby to the health facility?
So what should be they should do home to home?
We are trying to do that, but we need personnel. We are used to doing
community health extension workers.
You remember the medical outreaches, the market outreaches. How did we do the polio? Do you remember those people in their green tabard? To the mosques, to the churches, to the primary schools,
So we
to the
train the
marketplaces.
trainers?
The trainers are trained. The trainers have gone.
How about looking at the primary health care?
That's what we have to
Yes.
look at.
Yeah, the primary health care center.
Ideally,
closest to the community.
exactly. You remember on
So
paper.
they can actually walk there.
Yes.
On paper, it's actually well depleted. It's close
well,
by.
yes, it's supposed to be within 5 kilometers. Everybody should nobody should be more than a 5-kilometer walk.
Okay.
To the
So
nearest
Dr. ALERO,
place.
can we now say that from what you are saying, being futuristic, is it not possible? You say it's on paper, right? Is it not possible to hold some people accountable?
It is
when
very,
you
very.
don't have it, they don't have it.
I love
Isn't it?
Dr.
It's a hold people
I love you
accountable.
dearly.
Oh,
That is what we are here to do. Speak truth to power.
Exactly.
And hold some people accountable.
And this is
And
what
it's
the
not
physicians
just
is doing.
Yes,
Yeah.
it's not just those at the top. I keep saying it. It's not from here we're going to go to Abuja and hold the neck of the president.
Yeah.
But we start from our local government. Who is your local government chairman? Who is the medical officer of health in your local government
Your
area?
councillor.
Who is your counselor? Who is making sure the children? Have you got? Everybody should ask the mothers of the little children whether they are immunized or they are not immunized. Because no mother wants to bury a child, and we've all done it now. When we did our pediatric outpatient, our pediatric emergency room posting.
Yeah, rural posting especially.
Even in the urban.
Urban,
well,
yeah.
I mean, there was a day I walked into the pediatric outpatient, and these 2 medical students were in floods of tears. They had barely got onto the duty this thing, and within like 90 minutes, 2 children had just died of measles.
And they are questioning themselves.
They're questioning themselves.
Is this what I
Is this what I signed up for?
Let us not continue to question ourselves as medical professionals. That we need to hold people accountable.
Yeah.
So now we know that it is no more 90%. We are right now at about 30%. And if nothing is done from that state you talked about, there's 0.something% in one
state. There's
in
in Zamfara state. Yes.
So what are we to do? Is being futuristic. Is for us to provide these facilities, ensure that the primary health centers are actually up and doing, and we have more community health providers. So it's to hold people accountable. Final word before we go away. Just final word.
Yeah.
Ask your neighbors. Ask everybody around you. Are you immunized? Are your children immunized? Just a very simple question, and that's what we need to do. Do you know the name of your local government chairman? Do you know the name of the medical officer of health? Are they up and doing? Is the PHC in your neighborhood functional? Exactly. If not, why not? And if you can take a picture and send it to the physicians, we know what to do with that kind of information.
Thank you very much, Dr. ALERO Roberts. Always very, very interesting having you as our guest, because you always feel it and you always say it the way it is. And I'm so glad you are very passionate about this public health. And if they listen to you, if they hear our voices, your voice, I'm sure we'll go a long way. At least, if nothing else from this program, we now know that at least we are from 91%, we are now about 30%. And for the future, if nothing is done, it's going to be like 0%.
Exactly.
We hope we don't get to that stage. And for everyone who has been part of our program today, I'm sure you actually benefited from what Dr. ALERO said. Vaccination, immunization. Are you immunized? Are you vaccinated? If you are vaccinated, then are you actually immunized? Are your children immunized? Your neighbors, are they also immunized? Do you know your primary health care provider? Do you know the primary health care center around you? Have you even paid a visit to that place? Even if you are well, you need to pay a visit to that place. You may just be the voice of the voiceless. Till next time, my name remains Dr. Martina Agbemie. Stay blessed.
Thank you very much, Dr. ALERO, but it's always amazing having you on set. For all our viewers out there, I think if you haven't tuned in every Saturday, 7:30 p.m. to watch, listen, and take note for your favorite health TV talk show, The Physicians, please make it a date now. Set your alarm and join us at every given time. This vaccination is not a one-size-fits-all, and it's not just about me. Make sure everybody around you get vaccinated and, of course, get immunized. Be kind enough to follow us on all our various social media platforms. And if you want to be a part of the show, just like Dr. ALERO Roberts, you are just a click away. Get to our website, fill the form, and you are here. You don't have to be a doctor. If you have a health issue you want to share, it's okay. If you are a health enthusiast, perfect. You can be right here. My name is Dr. Memuna Yusuf Kadri. Until next time,
every day and in every way. Enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.